you hear me?
Good morning, everyone. Can you hear us? We're live on Facebook. We're live on Facebook. We'll wait 3 minutes. If you see the chat on the bottom of your screen and you have any questions, please write them down and I will tell Dr. Krantz any questions that you might have. I hope everybody's doing great.
Can you hear me?
We can hear you. I'm going to mute everybody else so that we don't get any distractions in the back. One more minute and we're good to go. I just want to be respectful of everybody's time, but I also want people to join in and don't feel that we started early. Can you hear me okay?
I hear you.
Okay, so good morning, everyone. I'm Gladys Mizrahi. I'm Commissioner of the City of Aventura. And the reason that we wanted to do this today is because I've gotten a lot of calls from parents asking many questions on how safe this summer is going to be for our kids. As school is over, Zoom is over, some camps are opening, other camps are not. That's the reason that I wanted to ask Dr. Krantz to join us and answer everybody's questions. So let me do a brief introduction. Dr. Krantz is the CEO of Krantz Care and the founder of Premier Pediatrics, a premier concierge service. Personalized, compassionate pediatric care and a health advocate. Strategic planning for changing healthcare dynamics and innovation and development of telemedicine and technological tools for care. So welcome, Dr. Krantz. We're really excited to hear everything you have to say and keeping our kids safe.
Hi, everyone. Hi, my friends and patients and families out there.
Yes.
The main emphasis of this is really children safe, and I think ultimately it comes down to us, and it's our responsibility. Even when you go for a walk.
Wait, I think you're too far. Let me interrupt you. I think you're too far from the microphone and we're not hearing you. We're not hearing you very well.
You hear me now
If
better?
you can put your audio.
Well, is this better?
No, I think you did. Can everybody mute yourselves, please? So that we don't have.
Can't hear me?
Very far away. Can everybody hear him? Let me put, okay. Okay, you want to try again?
Can you hear me now?
Better, it's better.
Better.
A little better? Well, as close as I can get. Better now? Yes?
Yes.
Okay.
Floor is all yours.
All right. So start with ultimately it's our responsibility to keep our kids safe, whether we have to social distance, wear a mask, stay away from people, or make certain choices based on our family and our friends and our level of risk. Um, and that's kind of the basis of this conversation, how to keep our family safe. That's it. All right, I'm ready.
Okay, so with summer upon us and parents trying to keep their kids safe, some of the cities have closed completely summer camps, while others are opening, keeping safe distancing and certain protocols. What's your take on summer camps?
Okay. Well, first off, it really depends on the family, the age, and your level of risk. If you have someone in the house who's immunocompromised, if you have little babies in the house, if you're pregnant, if you have elderly in the house, then it's a whole different conversation than if you're just you and your children. I think my view of camp is based twofold. One on if you have small children and one if you have older children. Older children, let's say 5 or older, will be able to handle the instructions in school better. Um, Small children, you'll really have to decide on how much you need them to go to camp. My overall conversation is how much socialization do they need versus the safety. Then we have to look at, tell me if you can still hear me. Then we have to look at each particular camp and the activities. Certain camps are doing a better job at keeping it safe than others, and how many numbers and which sort of activities we're talking about. You want to ask me more questions or you want me to keep?
I have another question. For example, the JW Marriott opened the Tidal Cove.
Right.
What's your comfort level with us going there?
Well, basically, you'll have to look at their guidelines and decide if they're limiting enough people from going at the same time, if they're going to be monitoring it, if your kids are old enough to understand the rules, and you can keep them safe and clean. But I think overall, a public pool is probably not a great place to go right now.
Okay. What about the railings in the parks? Now that parks are reopening again.
Right. So I think the railings have a very special risk. If your child's older and they really know not to touch their face, and you can monitor them and wipe their hands, but I think any child, certainly under 6, it's going to be difficult to have them touch a railing and not touch their face, and their nose and their mouth. So I think you can keep them restricted from that. I think that would be safe, but very limited.
What happens if your son or daughter has a fever and gets sent back to the house?
So if we're talking about in camp,
In camp.
yeah. So part of the whole conversation is what are the guidelines for camp? What are they going to do? One of the big concerns I have is not necessarily what their guidelines are, because you can see that up front. It's the what if. So you have to assume the germs will be coming, especially when kids go back to camp, and you have to think about what
I'm trying to fix it.
you have to plan on for the what ifs and see what the camp's going to do. So almost every room is going to probably have some sort of virus or illness, and then how is the camp going to handle it? So my concern as a pediatrician is what is going to be my way of dealing with it, and how are we going to know if your kid has coronavirus, which is a concern. What the camp's regulations are going to be, how are they going to let the kid back in that room, and are they going to let any other kid be with them or back in the room if they have fever? For instance, your child has a fever, all of a sudden the flu is going around, or croup is going around, or hand, foot, and mouth is going around, and you go to the doctor. What are the requirements to go back? Is it just a note? Are they going to require you to have the COVID-19 test? And then which tests are they allowing? Because in most medical facilities, they don't accept a negative. If you get tested, for instance, in one of these large facilities that they're running right now, a negative means nothing. Will they take your child back into school or someone else's child back into the camp if it's negative? I can't write a clearance note and say your child does not have COVID-19. I can only write a note saying the test that we did was negative. Now, if you do a nose PCR, then the reliability goes way up, and that test will take right now 3 to 4 days. There are some places like Joe DiMaggio that can get that done in 24 hours. So saying all that, if your child has a negative, now if your child has a positive, we know what it means. If your child has a negative, what are their requirements for coming back? Because eventually, like in regular school, most of the kids in that classroom will probably get sick, will probably get fever. And what is the school, what's the camp deciding to do about that room? Does everyone have to be out until they're over the fever, like 3 or 4 days, like any other basic cold? But then if it's positive in that event, what is that camp going to do? And I'm sure they're already telling you, if they have a small room, are they going to close it? If it's a sleepaway, what are they planning? If it's a sports camp, what are they planning? So we really, I'm trying to focus on the what if someone's going to get it, because I always work backwards. Someone's going to get sick, what are they planning? And then my main concern is, once school starts, like I always say, everybody's going to get sick. And how are we going to handle that? Me as a pediatrician, what is my view of writing the note to get back in school? What tests am I going to do? And how can I assure that school and camp that that kid's safe to go back? And I think that's going to be the difficulty of anything, especially.
I have another question. How can kids follow rules and instructions if adults clearly are not doing that right now? For example, in the city of Aventura, in the golf course, shopping centers, and everything, which
So-
we're literally trying to enforce. But yes, you have a point. It is very difficult.
Right. So unfortunately, today I read a couple of articles. One is in the New York Times, that there's already an upswing just around the world from everyone doing what you're saying. People, whether they think it's really gone or they just want it to be gone and believe it's gone, or they just want to go back to normal, there's already an upswing in the US and Florida of the number of cases. In a New York Times article and epidemiological articles, they're saying that there's going to be a tremendous second wave in fall, but it might come, sooner in the summer, of coronavirus. They say by the fall, there might be 10 to 20% of people who've been exposed, which leaves 80% of people who haven't had it. And people have this false sense of security right now, whether it's real or just they want to believe it. So you're right. But how it started, that it really is ultimately our responsibility. When I go for a walk in the morning, I count how many times I have to move off the sidewalk. And, initially I was upset, like everyone else is not doing it. It's really my responsibility to get out of the way. And that's what I'm talking about. If you have an older kid that you can talk to and put on the mask, or the camp we're talking about specifically has strict regulations and a way of dealing with it, we're going to say you're more safe. Obviously, the only way to be safe is complete social distancing and not going out, but that's not necessarily realistic. The idea is, how are we going to modify and mitigate all these situations when you go out in public? And I think we as pediatricians, and you as the parents of your children, and if you have family members and elderly, you're just going to have to be vigilant, because the public at large is not paying attention until the second wave is coming. And I think it's going to be here sooner than later. On the positive side, and these are all speculative articles, and we don't know as much as we would like about COVID-19 yet, and it keeps changing every single day. If you notice, it goes back and forth. They say humidity helps, which we've known for a while, but we have the most humid place, one of the most humid places in the country. So I think outdoor activities are good. It's not going to travel as far. You still have to have the same rules and regulations, but the whole idea of this discussion and future discussions are, how far can we let our kids wander from our fear in our home versus what everyone else is doing outside. So that's, my idea is, starting with the camp, what are their rules? How can they enforce it if it's really true, and who's supervising it? And then what sort of activities they're doing. Everybody, I've been having this conversation for a few weeks, and people want to know, what are the activities like track and field horseback riding, tennis. There are better activities than others that we can control the kids, maybe not young kids. So when you go out in public, masks are still recommended. If you're going anywhere where there's people and you can't social distance, then you're just going to have to make that decision. Is it worth it? But we still have to have these conversations with our children and our families. And it's hard to, when everyone else is not doing it, including kids and families, it's hard to give that message. But it's just as important now as it was 2 months ago, to keep the distance and keep them safe and really speak to them about what's at risk in a nice way.
I have another question. Is hand and foot the same as the Kawasaki disease?
No. Hand and foot is Coxsackie. Hand and foot is where you get sores on your hands and your feet and your mouth. It's very similar to some of the symptoms of COVID-19. So you do get little sores in the palms and the soles and sores in the mouth and fever and chills and everything else.
So how do they recognize between both of them?
That's going to be
The challenge?
It's going to be the challenge coming up, because right now, my goal will probably be, how do we deal with the fever? What are the symptoms? Is there a rash? And then we have the Kawasaki-like syndrome that people are going to be afraid of. So I think the challenge for me is going to be when fevers start, and it's already starting, and people call me up. What's your level of fear? What's my level of fear? How sick is your child? And how are we going to handle it? Right now we still have the flu test, the strep test, the blood count. And how are we going to handle the unknown? Because most kids are going to not have symptoms or bad symptoms, and they're just going to have maybe fever or nothing. And it's really going to be difficult not to spread it once we go out. The good news is we still believe that the vast majority of children have minimal symptoms and maybe a little viral symptoms. So that's the good news for the children themselves, which ups the ante of who you're around. Does that answer that question? Yeah.
What for older children, teenagers, where are the safest place that they can go this summer?
Safest place meaning camp versus school versus, depends on your child. It's individual. If they're going to social distance and they understand the dynamics, I think local mini camps where they can segregate the activities, whether it's like art or music or sports, where they're not in large groups. I've had this discussion with many patients. Some people, most sleepaway camps are closed, but some people I've spoken to, other physicians, say that sleepaway camp may actually be a good idea, because if they test everyone before, which is another aspect you should ask your camp, is everyone going to be required to have a test before? In the sleepaway camps that are still open, they're requiring a test 3 days before, and then at 2 weeks, and they're not allowing anyone into camp the whole summer, which presents another fear. And once you get past the 14 days, as some of my friends have said, you are safer there than anyone else if no one else can come in. But I'm fearful of sleepaway camp. But other than where you can control all the elements and the people traveling and everything else, I think for teenagers and most kids, are they testing before? How are they going to monitor the fever? When people travel, let's say in the middle of the summer, and they come back, who is controlling those situations? And I think those are some of the questions to ask the school, which I know has come up this year, where somebody traveled to the Far East and the school wouldn't let them back. So those are things that have come up. And really it all comes down to your level of fear and who's going to be exposed to your children.
How safe are the condominium pools? Is there a risk about touching the chairs, the tables? And what about being in the water with other kids?
So, yeah, obviously the chairs, the tables, everything, fortunately chlorine is going to kill most of the COVID-19, so most things will be coated in it. But yeah, if you're sitting anywhere, forget the pool, whether it's on a plane or public or restaurant, it's the same rules. It's your responsibility to clean it, have your wipes, before, during, after. If you're in the pool, If it's a situation you can control, then I think it's reasonable to say your kids are away and you're in the pool and you're monitoring it. Like I had a patient who went to a hotel recently, and when it got too busy, they went out of the pool and they went home. So it's really, it starts with the same concept. It's your responsibility to monitor the situation when you're in a pool, when you're with your family. That's why we're talking so seriously about camp. Do you trust them? What are the regulations, and who's supervising it to make sure they're really doing it?
Okay, another one. I'm planning to travel from South America to Miami, and I feel USA regulations are somewhere laxer than other places. What age group do you mean when you say elderly?
So if you can get in from South America here, you're right. It's very lax. Elderly, they keep changing it. They say 65, 60, 65, 70. It really depends on the health, the medication they're on, and the immunological status of the patient, the person. We're really 65 and older right now. Certainly 60 if, I'm trying not to make jokes, certainly 60 if you really want to be concerned.
Do you recommend people going out and get the antibody test
Well,
or the corona test, even if you don't have symptoms?
So the antibody tests right now, the vast majority of tests that you can get easily around are not accurate. Like we said, negatives mean nothing. The problem with the testing, if you get it and you're negative, you feel, okay, I haven't had it, I'm okay, but we don't know that for sure. The problem with the antibody test, we still don't know what that means. If you are positive for antibody, does that mean you have lifelong immunity? Does it mean you're protected? It makes you feel good. Everyone wants to already have it. Everyone thinks they've had it. So having the immunity, might make everyone feel safe, but we really don't know what that means. So that's kind of the fear. Secondarily, most of the tests you can get are really not reliable now. There are some good antibody tests. Some of the major labs like Quest and LabCorp have good tests. Joe DiMaggio and Memorial just opened up a good one this week. But it really depends. Should you just going around getting the test just because? As long as you know that a negative doesn't mean anything, and you would have to do it again if you start to have symptoms. That's up to you. I don't think it's necessary, but.
What is your opinion about going back to school? Maybe two groups of online classes and physical presence for those kids that cannot stay at home due to working parents?
Right. I mean, I think, working parents have a different set of concerns, but school is going to be sort of the same dynamics as camp, only the decisions will be less up to you and more to the school. If they have all the guidelines that we're saying, it seems like they're going to be just some split programs. If they clean the playground, like they say in between, if they enforce the social distancing, and everything is only limited. I mean, they can't completely social distance kids running around a classroom. I mean, it's already been proven in France within the first week, a whole bunch of schools closed down. That's what I'm talking about, the what ifs. What are they planning on when kids get sick? Those are the main concerns I have, not necessarily whether it's going to happen, because it's going to happen. And it goes back to the same thing. What are your risks in your house and your child's risks for getting it? Because it's going to happen. We know there's going to be an upswing. We know kids are going to play with each other, and we know they're going to get sick. So all those questions come into play. The decision is what each school, and private schools have more say on than public schools, but it seems like they're all taking it very seriously, and they're going to do a lot of cleaning. And as parents, you are allowed to go in and say who's cleaning, who's monitoring, what are they doing with the, are they cleaning the desks every day? Those are things you're going to have to look at.
In the tennis camp, there is a part where they go inside.
Right.
Is it better to avoid the camp altogether?
So, obviously we like the outdoor activities. Tennis camp, it's great. My favorite is horseback riding, because you really have social distancing there. We have to be, real and know that in South Florida, we're not going to be able to be outside. It's probably going to rain every afternoon, and they're probably going to eat the meals inside. It's the same rules. How are they going to keep them separate inside? Or is it going to be small groups? Can they eat outside, for instance, over, some of them have like a porch where they can keep them outside, which I think is better. But yeah, you have to look inside and make sure they're cleaning it in between groups, because I think a lot of the camps are going to rotate who's going in and who's not. Are they cleaning in between groups? And who is enforcing it? Are the teachers, are the counselors wearing masks? And the other thing about counselors are, who are the counselors? Are they teenagers that you trust? Are they teachers? Are they really going to follow through with the guidelines? But going back to should you go or shouldn't you go, it's the same level of fear that you have.
So now everybody's going to panic if they have a small fever.
Right.
If the kid has a small fever or just a runny nose, the panic is going to start. How do we avoid that? Or what's your advice on that to avoid the full panic attack from parents?
Well, we're not going to avoid full panic. Hopefully, and there's people that I've spoken to so far, my patients, understand that most children will not get very ill. And if they're not showing severe sickness and some of the symptoms like respiratory illness, trouble breathing, fever for days with a rash and red eyes, then most parents are seeming to handle it. I think people will panic if several kids in the neighborhood are going to get like Kawasaki symptoms or end up in the hospital. I think generally speaking, people will understand that most kids will not get that ill, probably 90%. But I do believe that, if the camps are doing their job, if the schools are doing their job, we're going to have to figure out how we're going to deal with all the fevers, all the germs. And when the flu is here, it's going to be difficult to differentiate it without having good testing. And those are my concerns, like everyone else you're watching on the news. Are we going to have a good antigen testing, which is coming, which means like the strep and like the flu test? Do we have a good antigen testing, like 80%, so we can test quickly? Like you can come in and do a strep test in my office. And then are we going to have treatment? Are we going to have a vaccine? So all those things will evolve, starting with good testing where you could come in and we could do a quick test. But for time being, we just have to decide how we're going to handle the fever and how sick is your child, and just have constant conversation with your physician, knowing what to look for when they get more ill and what to do. Because basic fevers, mild symptoms, there is no treatment anyway right now. So we really have to just modify what we're planning and see when it's time to seek care, and keep a good conversation with your physician.
Have you had any, are shields the plastic shields working with small kids?
I don't know anybody's been using them. I think if you can get a cute, Batman or Frozen shield, that a kid will wear, I think shields would be great because they're going to be coughing and spitting on each other. I haven't seen one child with a shield yet. Everyone knows I wear a shield. I'm sure you've been reading that a mask and a shield gives you probably the best protection. Maybe you guys know, I haven't seen a really cute shield anywhere for kids. No.
That's something to look forward to. Have you had any positive cases in your office? And if so, what were the symptoms?
I have not had any children with COVID-19. I've had one college student who had COVID toes. And if you know what I'm talking about, it's after it's done, you get sort of like Coxsackie on your toes, little purple marks all up and down your toes. And that person must have had it. I've had families that have had it, but no little children have had it in my practice. But like we talked about, I haven't had the need to test anything.
Another question. Do they still believe children get a milder COVID infection?
Yeah,
Is it really less dangerous than deadly for kids than adults?
Here's the problem. We don't know how many people have it. We don't know how many children have it. With the number of children, let's say in New York, that are getting the inflammatory syndrome, let's say there's 200, but we don't know 200 over how many. And that's the problem. We definitely still think that children get a very mild COVID-19. We think the majority of people in the world have a very mild case. if not just a little viral case. We don't know yet. In studies that they've done in California and the Far East, they say that they think it's 50 to 60% more people have it than we know. So if you take the 200 children in New York that had the complications and they didn't know they were sick, it's only after they were diagnosed with the Kawasaki-like syndrome, you know, you have to assume there might be thousands and thousands, even millions of children that have had it. So if you say 1 million children had it and 500 children have the complications, then the risk is still extremely minimal compared to anything else. And that's what we don't know. We definitely believe that children have a slight risk of getting complications and very severe illness. There are a couple things that have come out recently. We think, we don't know, that there might be a little cross immunity, that because kids are always fighting colds and viruses, that coronavirus is one of the cold viruses. It's possible that they're on red alert and they're always fighting it. But we don't know that. So that's just speculation. Every day there's a new article. But yeah, as of right now, with the numbers that are out there, we think kids have mild symptoms.
Does Tamiflu help at all?
No, not at all.
Not at all?
But that may change in another month. But no, Tamiflu doesn't help.
Okay. Anybody else with questions? I don't see anyone else. Do you want to finish with something? Any last minute advice?
I think two factors. Number one, the testing. A lot of my patients have had testing on their own and gone different places, and that's fine if people are concerned. But most of the testing is not reliable, and you've been reading this too. If you've been reading what physicians say, positives we're not sure what to do with because we don't know the immunity, but negatives aren't helping us whatsoever. So it's real important you take that into account. It's also very important that we don't make random diagnoses and leave the diagnosis up to parking lots and random people. It's very important that you make the diagnosis in consultation with your physician. I've had several people tell me that they know friends and family who are very ill and the tests were negative repeatedly, but the physician said they had it. So clinical symptoms, timing, exposure are key, but you really can't leave it up to yourselves or just the community to decide this is it or it isn't, and I can go back to normal. And that's my fear, and that's what you see. People think they're safe. And ultimately, like I said, it's really up to us. And don't be afraid if you think you're the only one in a situation with a mask. I mean, that's your risk and your children's. Thank you.
I have a
Dr.
question. I can't seem to type it.
Go ahead.
What's the thinking on kids coming home from camp where we think they're relatively safe, but then going to their grandparents? What are they saying about the transmission?
Yeah, I mean, it goes in the age. I mean, when people ask me that question, I mean, any grandparents that are over 65, I really think that you still have to, I mean, it's a dilemma right now, but I think the grandparents should be wearing masks at the very least. Once the children are going out of quarantine, they're going to be carrying it, and that's just how it's going to happen. We have to assume, like everything else, that it's around and that by the fall, and though we have humidity, so we can say we're relatively protected, by the fall, it's going to be rampant. Once kids go back to school, you know, like I call this the germ capital of the world, we're going to have lots of germs and everyone's going to panic because we're not going to know. I really think anybody who has immune compromised, anybody who's over 65, anybody who has elderly grandparents or babies or anybody in the house have to be careful, and you can't be cavalier about it. I think anybody over 65 should stay away from kids who are no longer in quarantine. That's going to be difficult, and wear a mask. I mean, you can't take too much protection till we have a treatment, till we have a vaccine, until we have really rapid, good antigen testing. That's kind of what you've been reading about, that everyone's worried about. How do we even know, you know, which is what you're asking. But I would stay away from grandparents over 65 for sure. I know that's painful, but yeah.
That's harsh.
Sorry.
Anybody else? Dr. Krantz, thank you so much. This was very helpful. I hope everybody got their questions asked, and it's really up to us to
Yeah.
keep our kids safe.
Be safe. Don't let your guards down.
Yep, don't let the guard down. Thank you, Dr. Krantz. I really appreciate it. Thank you, everyone. And next Wednesday, we're planning something with parenting. So I will let you know. And have a great day. Stay safe. Be responsible. Bye, everyone.
I have one more question, if I may. May I?
Go ahead.
Once you, let's say you're on a plane and you land, how many days right after you get sick, you get contagious, will you test positive?
So, yeah, you know, one of the things I've been reading is if you do the test too early, like on the day 1 or day 2, it may be negative. But they're saying that the crucial time to do the testing is somewhere between 2 to 3 and 7 days. If you do it too late, they're also saying, and remember, all this is still unfolding. We don't know. So they say that if you do it over 7 days, they think it's also going to be negative. So really there's a crucial timing, which is why having doctors involved is important. You know, you come in the first day and I do it, it's negative, it means nothing, you know. So really somewhere between 2 to 5 days, they think, if you're having symptoms and if you have COVID-19 is the most likely to be positive. So still have to quarantine if you're coming from a place, reasonable quarantine, if you're coming from a place that has it everywhere. My wife flew to Denver with my daughter and to see my daughter, and basically she wore a mask for 14 days just to make sure. So you have to take reasonable precautions, I think.
Thank you.
Thank you, Dr. Krantz. With this, ending the meeting. Have a great day and everybody stay safe. Bye.
Aiden's